Hi, I'm Mark Cooper, board-certified gastroenterologist, and we're talking about procedures I perform to investigate the health of your gut. And today we're going to be talking about a colonoscopy, one of the boldest advances in medicine because it takes bravery on your part to allow me to run a nearly 2-meter long scope up your rectum. But we're going to talk first about the fact that it is very safe because it's also surprisingly flexible. And you can also be assured that it'll be very respectful. There's a big team in the room for this procedure, but we're all on your team, and we're going to make sure that this is safe and comfortable. And anesthesia's there, and they're going to be giving you a nice cocktail to ensure that it is a comfortable experience. So I want you to be foremost assured of that. But why is it that it's so bold? Well, it's because a colonoscopy affords us the opportunity, perhaps more than anywhere else in medicine, to actually prevent cancer. We can go in, we're looking for polyps, and when we find them, remove them. Now, we'll talk about some other reasons that you may need a colonoscopy featured in some of the other videos, but here primarily we're just going to talk about what is a colonoscopy. A colonoscopy starts with an effective prep because in essence, I'm a skin doctor. I'm looking at the skin inside of you, and inside your colon it's called the mucosa. Getting that colon mucosa very clean affords me a very good view so that I can find any pathology that may be of concern. We'll talk elsewhere about how a effective and comfortable prep can be achieved. Now, when you actually go in for your colonoscopy, you're going to have a check-in process, and you'll be going to one of two locations. If you are healthy, and this is a relatively general exam, then you're probably going to be going to an endoscopy center. And these are specialized centers that really just focus on endoscopy. They're very efficient, and that gives you a very good experience, and they tend to be more affordable than a hospital setting. Now, if you're older, maybe have certain comorbidities or a specialized procedure, then you'll be going to a hospital. And that's the safest place for you to be in those circumstances because you have the full gamut of the capabilities of hospital should there be a need for a higher level of care. So as I warned you, when you enter the endoscopy suite, you're going to find a crowded room, and they all already know you. It's like you're famous. But who are you going to meet? You're going to meet the endoscopy nurse, the endoscopy tech, and the anesthesia team, which may consist of an anesthesiologist as well as a nurse anesthetist or an anesthesiology assistant. And then the gastroenterologist will be there, who you probably have already met in the office. So after you've had a chance to meet your entourage, the anesthesia team is going to put you comfortably asleep using medications introduced through your IV line. After you're asleep, my work begins. I'll be using a colonoscope to look into your rectum and colon, and after traveling around, possibly into your small bowel. We then start to work backwards, looking carefully for polyps or other concerning lesions. Things that I find, I'll work with the endoscopy tech to introduce instruments through the colonoscope so that we can take biopsies of any concerning tissue or remove any of the polyps that we find so we can prevent cancer. Some questions that I'm frequently asked about this procedure. Am I going to be asleep? Yes, you will be comfortable and asleep. People also are sometimes concerned, will you remove my colon? No, that is the job of a surgeon, and I will not remove your colon. They also want to know, will you remove polyps that we find? And the answer is almost always. Sometimes if it's a really large polyp, we may invite you back for a separate procedure that focuses on removing that polyp because that can be a prolonged case. People will also ask about risks. Those main risks are bleeding and having a tear of the colon or having a complication of anesthesia. All of those risks are really rare. There's also been concern about infections that may be acquired from the equipment. That's also very rare because the colonoscope is thoroughly processed and cleaned between every case, using a series of steps, each which ensure that any bacteria, viruses, or other organisms are cleaned from the scope. Families frequently want to know, how long does the procedure take? From your family's perspective, it could be quite a while, almost an hour or even more, because there's travel time to the endoscopy suite and there's recovery time afterwards. The procedure itself, though, really only lasts about 20 to 30 minutes. And from the patient's perspective, it's over before you know it because of the anesthesia. Shortly after you wake up from the colonoscopy, we'll be able to provide you information about what we found. when you need to return for a future exam, and any biopsies that were taken. We'll also be able to give you advice if you're on a blood thinner medicine, when you can resume that. And perhaps the key thing is, when can you go and eat? And what can you eat? Generally, you'll be able to eat whatever you want. We encourage you, after having a long prep and having to have a modified diet, eat something you really enjoy, because you've certainly earned it. Biopsies that are taken will take about a week to be processed. They need to be sent to a pathologist, slides prepared, and an opportunity for the pathologist to take a close look at those and give us a report back. So anticipate hearing from your doctor's office in about a week with the final results. I hope you found this information helpful to understand what a colonoscopy is. This is general information, not intended to be diagnostic or medical advice for any specific individual. We hope that you enjoy this information and encourage that you subscribe to the channel to seek out more information to better understand your gut and how to keep it at its healthiest. I'm Mark Cooper. Thank you for joining us.